Welcome to the Paubox News Roundup for the latest HIPAA, security, and healthcare marketing news. The wildfires in Maui have taken a devastating toll, with the death count in Lahaina reaching well over 100 and many are still missing. As recovery efforts continue, the HHS declared a public health emergency, which includes a limited waiver of HIPAA sanctions and penalties to meet emergency health needs with more flexibility. UMass Chan Medical School is the latest to warn patients of a breach resulting from the notorious MOVEit attack, with at least 134,000 Massachusetts residents impacted. Meta moved to dismiss a class action claim against their use of the metapixel that alleged a violation of patient privacy. The judge said the case will be allowed to move forward. Nashville-based Vanderbilt University Medical Center is currently under investigation by the Office for Civil Rights for releasing transgender patients' medical records to the Attorney General's office, a move that sparked a significant backlash among privacy experts. Lastly, Tesla experienced a significant data breach that affected over 75,000 current and former employees. It appears to have been an inside job. The Lahaina wildfire has displaced thousands and caused extensive damage to infrastructure. Health and Human Services Secretary Xavier Becerra declared a public health emergency for Hawaii. This allows greater flexibility for healthcare providers in the Medicare and Medicaid programs to meet emergency health needs. The waiver means that healthcare providers can provide services without facing sanctions for HIPAA non-compliance due to the wildfire's consequences. The waiver also includes provisions related to HIPAA privacy regulations, ensuring that hospitals can operate under disaster protocols without facing penalties. The MOVEit breach was first disclosed by Progress Software, a Massachusetts-based company, on May 31st. Since then, more than 600 organizations worldwide have had their data compromised. It's estimated that up to 40 million people have been affected, with personal and health information released. Now, health officials in Massachusetts have issued a warning, stating that at least 134,000 residents may have had their data stolen. The breach impacts patients of UMass Chan Medical School in Worcester and contains data including names, dates of birth, financial information, social security numbers, and more. The Clop ransomware group has taken credit for the attacks and is expected to bring in between $75 million and $100 million from extorting their victims. While many organizations are now opting against paying ransoms, Clop is compensating by demanding higher amounts from victims who are most likely to pay. Over a year ago, a class action lawsuit was lodged against Meta, alleging that tracking by the metapixel violated patient privacy. The case was formed partly due to a report released by the markup, which found that the metapixel was being used on hospital websites across the country. The report found that the metapixel was collecting a broad range of data, including patient names, medical conditions, and appointment dates. Meta has maintained that their use of the metapixel is lawful, claiming that it's used to help hospitals track effectiveness, does not significantly infringe on privacy, and that if it does, the hospitals using the pixel should be held liable if needed. In May, Meta filed a motion to dismiss the case, and now a judge ruled that the case can move forward. Hospitals and other healthcare organizations should pay close attention to the case, which could set a precedent for cases to come. Vanderbilt University Medical Center agreed to release records of trans patients to the Attorney General's office. While VUMC released the records in late 2022, they only informed patients in June 2023. The records were allegedly part of an investigation into medical billing. But with legislation related to transgender rights on the rise, the move sparked significant backlash among privacy experts. Now VUMC is facing a federal investigation, coinciding with 2 patients suing the hospital. According to a news report by NBC, the patients suing over the information's release argued that identifying information should have been removed before turning over the records. Under HIPAA regulations, medical records may be released for a civil investigation, but they must be released in the least intrusive way possible. On August 18th, Tesla filed a notice of data breach with the Attorney General of Maine, stating that sensitive employee information had been made available to an unauthorized party. Turns out that 2 former employees leaked the data to a German media outlet whose name I'm not going to attempt to pronounce. The newspaper, known for its in-depth business and financial news coverage, is now at the center of a major corporate data breach story. Tesla has initiated legal action against the employees believed to be responsible. In other news, the National Institute of Standards and Technology has drafted a significant update to its cybersecurity framework to address the evolving cybersecurity landscape and make the framework more accessible to a broader range of organizations, including those in healthcare. I'll leave a link in the description. Oh, one last thing. Do you know the 18 PHI identifiers? Check out my video on what is generally considered to be protected health information. Link below. That's it for now. See you next time. Cheers.